My father always taught us, if you have been given an opportunity in life, if you've been afforded privileges, then it becomes your responsibility to do the most with that you can to help those that do not have the same opportunities in life. Now, I am 28, I'm still very young. The challenges that I'm trying to tackle are very big challenges. A lot of people think, it's not even worth trying. But if we don't try, if no one tries, then we're not going to get anywhere. So to say we want to work on a broken health system, some people will say it's futile, but it always seems impossible until it is done. When we look at South Africa, we've got about 0.4 doctors for every 1,000 people in the public health system. Now that is not a lot. That is less than a third of the world average, which is 1.5. As a public healthcare system, we are under a lot of strain, and there's a lot of reasons for that. There's a lot of potential solutions for that. So we started raising funds from corporates and from non-profits, and we use that money to allocate healthcare workers to emergency rooms that are under a lot of pressure. Think, emergency rooms on Saturday night, places where it's really tough, long waiting times. We put extra doctors there, and we've helped over 1,600 patients to date, and we haven't been operational for that long even. Our mandate is we only support public health facilities. So we don't support private facilities. We want to help the people who need help the most. And 84% of South Africans rely on the public healthcare system, which, as we mentioned earlier, is under strain. Nelson Mandela inspired me by being the David in a David and Goliath fight. He took on a massive challenge. He took it on with a lot of courage and with a lot of humility. And that for me is inspiring. And I think it's worth remembering that what he did for others. And he gave a lot of himself so that others may live a better life. And I think that is truly inspiring.